Good evening, Madam Mina. We can hear you now.
Trying to... Okay, please a minute. I'm trying to share my screen.
Okay. All right. So as we are waiting for Madam Mina to share her screen, I'll urge all of you after this training, do well to visit our social media platforms, Facebook, Instagram, X, and Twitter as well, and then okay, so that you can have notifications on our upcoming programs. There's going to be a program for teachers, in line of special educational needs, autism spectrum disorder, understanding how to teach autism or care and managing children with autism. Yes, so do well to visit our social media platforms, and you are going to have these notifications, and then it's going to help you as well. We also do post trainings with regard to seminars, and then entrepreneurial trainings, teaching trainings, and other forms of trainings that will help you be able to develop as a CPD and also as a professional development. So do your possible best to like our social media platforms, follow, and then you're going to get notification to have access to all these trainings as well. All right, Madam Mina, if you're ready. Okay, Madam Mina. Madam Mina. All right, we can see your screen.
Okay. Thank you so much for your patience. Okay, I'm sorry. I'm very, very
Don't
sorry.
worry, you have all the time. You have all the time, don't worry.
All right. So for the past 2 days, we've been talking about what autism is all about. Mrs. Gazy made us understand what autism is all about. Yesterday, Miss Ashley took us through how we can communicate with autistic individuals, especially how to understand their emotions. And this evening, we are going to talk about, or we are going to know how to understand and support children on the spectrum from a behavioral perspective. Okay, so we are going to provide, I'm going to provide caregivers with clear understanding of autism and manage and support children on the spectrum and challenging behavior. So first of all, what is autism? We all know from the previous presentations we've had so far that autism is a neurodevelopmental condition that affects how an individual communicates, his or her social interaction, and how the person sees the world. We say it is a spectrum because it differs from person to person. So no two autistic individuals are the same. So let's look at some characteristics or common characteristics of autism. So one, we have difficulty with social interactions. So they avoid eye contact. They have trouble understanding emotions. And also sensory sensitivity, like example, they react strongly to sound, light, or texture. And leaping. They can line up objects for a very long time and also rocking of objects. So these are some of the repetitive behaviors they engage in. So why do children with autism display certain behaviors? We all know that we as an individuals, or like we in quotes, normal people, that we are not on the spectrum, we all display certain behaviors. When we are happy, there are behaviors that we put out there. When we are sad, there are certain behaviors we put out there. When we are hungry, there are certain behaviors we also put out there. The same happens to autistic individuals. Every behavior they put out there is a form of communication to us, especially with the non-verbal autistic children. Every behavior they put out there is a form of communication to us. either they are attempting to communicate their needs to us, or emotions or their discomfort to us. Also, some behaviors may seem as usual to us, but to them it makes sense. For example, the hand flapping. So when you see it, you might think this is an unusual behavior, but to them, sometimes it is used to calm themselves down. And also, another thing we have to take notice of is, instead of us focusing on stopping such behaviors, we have to understand the why behind the behavior, why they are engaging in that particular behavior. So we shouldn't be in a hurry to stop them. But first of all, we need to understand why they are putting up that behavior, and then help them. If we are to redirect that behavior appropriately, then we do that. So let's move on to look at the ABC model of behavior. ABC model of behavior. So when I say ABC model of behavior, the A
Oh,
stands for antecedents.
okay, Madam Mina, let me come in a little. Excuse me. All right. So I just received some feedbacks, and some of them are saying that today happens to be their first time joining the meeting, and so they didn't have the
Okay.
opportunity to understand autism from the previous sessions. So as you go on, please do well to hit a lot. No need to go back. But as you go on, please do well to hit a lot on autism and what actually it means, and some of the things they can look out for, because they didn't have the opportunity to join our previous meetings. Thank you very much.
Okay, okay, all right, you're welcome. B stands for the behavior, and the C stands for the consequences. So when we say antecedents, we mean what happens before the child engages or displays the behavior he or she is displaying. And the behavior is the actual action that takes place. The actual actions that take place. And the consequences is what happens after the behavior is being displayed. What happens? So I want to give an example. I want to take us through how we will take record of this ABC model of behavior. So when you look at where the antecedent is, the explanation is what happens before the behavior. So when you are taking record, or you are recording the ABC model of behavior, first of all, you don't have to read meanings into what you see. You record this, you record it as it is. So maybe for the antecedents, you would record the time, the settings, and the people who were around. So maybe the time was maybe 2:15 p.m. It was in the classroom. So 2:15 p.m. in the classroom, teachers were present. Then when you come to the behavior, the actual action that happened, maybe the child started hitting the table, started crying, and you just record it as it is. Don't read meanings into it, that because the child started hitting tables, started crying, yelling at people and all that, so it means the child is throwing tantrums. Don't read meanings into it. Just record what you saw at the behavior aspect. And with the consequences, when the child did that, what did you do, or what did the environment do? Did you take anything from the child? Or when it happened like that, did you calm the child down? You also record it. Gave toy, maybe you denied the child of a toy, then you record it. Maybe you gave the toy back to the child, sorry. Then you record it here. Gave back toy to the child. You record what exactly happened, but know that you don't have to read meanings into it. You just record whatever you've seen. So the model helps us to identify patterns and understand triggers of the behavior. For example, when you record everything, and for about a week, you get to know at exactly 2:15 p.m., this is what the child engages, or the behavior the child displays. So it gives you idea. Okay, maybe we go for lunch at 2 p.m. and it is 2:15. Now the child is used to the 2 p.m. When it is 2:15, the child is still not getting his or her lunch. Then that is when all these things display. Now it gives you what triggers it. It means is the food or hunger is what triggers it. So you get to know, okay, at exactly 2 p.m. from now onwards, I'm going to give the child his or her lunch. Now let's move on to look at some common behavioral challenges in autism. Some common behavioral challenges in autism. One, we have meltdown versus tantrums. How will we be able to differentiate between meltdown and tantrums? Most of the time, we mistake meltdown as tantrums and we mistake tantrums as meltdowns. So when we say a meltdown, it's an uncontrollable response to sensory. So a lot of autistic children, or almost all autistic children, are very sensitive to light. Some are sensitive to texture and some are sensitive to noise. So when they find themselves in an environment where there are these things, they start to they start to have some meltdown. They are not able to fit into that environment. So for example, you take a child into a room and the light is on. You can see or you could see that the child is uncomfortable. The child is just moving up and down, just putting up certain behaviors. That should show you that the child is sensitive to light. So what you have to do is to just either put off the lights or take the child out of that room. So you make the place conducive for the child. And when we say tantrums is like, is goal driven. Tantrum is a goal driven. So with tantrum, the main thing you'll be able to know is when you take, maybe the child is crying because you took a toy from the child. Immediately you give back the toy to the child. He or she stops crying. Immediately the child stops crying. That is tantrum. But with a meltdown, they engage in certain behaviors until they are calm. They feel okay. They will never stop. But with tantrums, when you just take something from them or you deny them of something they want to do, they start to yell at you, they start crying, making noise. Immediately you give it back to them. Then they start putting up all those behaviors. Let's move on to look at the repetitive behaviors. Repetitive behaviors, they are also known as the steaming. So, like I said in my previous slide, that hand flapping. Some can also spin. Some like spinning a lot. Some can also turn around for some number of minutes without getting tired. So when you see these behaviors, you might think it is unusual, but with them, it is a way of calming themselves. It is a way of calming themselves. Instead of you stopping it, you redirect it. Some of them to like chewing things, or anytime they see something on the floor, they just take it, put it into their mouth. So when you see that maybe you want to redirect that behavior, you need to get, we have, I wish I had it here, you need to get a chewing toy. So most of the time when we get a chewing toy, we get a rope or a tie and tie it with a chewing toy, put it in their neck. So anytime they are chewing something which is not edible or is no good, you redirect the person or the child to the chewing toy or put it in the child's mouth. It's very hard. So the more they chew it, at a point they stop because they've come to realize that it is very hard. They are not able to crack it. And also aggression or self-injury. Sometimes we are so quick to say the child is very aggressive. I can't handle the child. The child is causing harm. This, that. Fine. It's mostly out of frustration, especially with the non-vocal autistic children. So when they want to communicate something to you and you are not getting it, or they are finding it very difficult for you to understand or communicate that to you, then that is when they engage in all these behaviors. For example, I have this client, or I have this child. I one day went to the school. Immediately I go to the school, I entered her class. I was very tired. So I wanted to sit down for like 5 minutes before I start sessions with her. So immediately I sat down, she came to me and she held my hand and wanted me to stand up, and I was reluctant to. Still, she was putting up that behavior. So I was like, oh, baby girl, stop. Let me rest for some minutes. When I'm done, I will attend to you. And she got angry. She started crying. She was on the floor all over. So I was like, what is wrong? I was trying to help her stand up from the floor, and she just raised her head, and I saw that she had a cut on her lip. And I felt very bad. I felt very bad. So when I sat down and she came to me, holding my hand, she was trying to communicate something to me. And because I was saying I'm tired, she got angry because she wanted me to understand or get what she was trying to tell me. But I didn't get it. So she started throwing things around. She was frustrated and all that. So that is the aggression. So sometimes they engage in aggression or self-injury when they want to communicate something to you and they are not able to or finding it difficult to. So difficult with, sorry. So another thing is they struggle with change of routine or unexpected change of routine. So when you are changing, they are always, autistic kids are always on strict routine, very strict routine. So when you are changing their routine, you just don't wake up once and just change it. You need to do it gradually. For example, you always have, so for example, you always have this particular room, you have sessions with a child. And because of some reasons, for some reasons, you want to change the room, you always have sessions with a child. Now, once a while, before you change, once a while, you need to take the child to the room. You play with the child maybe for like 3 minutes, then you come out to go to your previous room. For the child to be used to that environment or that room before finally, but you just don't go and just change the room. You just take the child to a different room. The child will feel out of place. The child will not be comfortable. Another thing is maybe as a therapist or the child had a previous therapist and a new one is coming in. Before the new one starts, it is advisable that the new one will go there for some, maybe 2 or 3 days before the old one leaves, just to mingle with the child, play with the child, for the child to be used to get to know the new one before the change of the therapist coming. Now let's look at some strategies to support positive behavior of autistic children. So we have one, effective communication. You have to use clear and simple language. Clear and simple language. So with autistic children, you don't talk to them like you are talking to every normal person. Excuse my words, every normal person. So for example, hey, Mina, come here. What are you doing? Hey, Mina, stop. No. So you use simple and clear language like come. It can be just a word or two words. Come here. Come. And when you give that command, it is advisable it goes with an action. Come here. Wait for some minutes for the child to process what you've said before you give another command or before you say another thing to the child. I repeat again. You don't say, hey, Mina, stop playing. Mina, come here. Mina, what are you doing? Mina, stop. Mina, I'll beat you. No, you don't do that. Mina, come here with an action. Come here. Then you wait for a while or come. You wait for a while for the child to process what you've said. Maybe you wait for like a minute or two and the child is not responding. Then you go again, come or come here. Also, we have to use visual support, picture schedules, social stories, communication board. So I want to show you, I want to show you some example. So when I say you have to use visual support, this is not the actual thing, but I have a parcel with images on it. I want to just use it as an example. Visual support to communicate with the child. So you want to tell the child, let me use this one. You want to tell the child to write. So you can say write and make sure you get the child's attention. So for the sake of those who were not here for the previous days or first time joining or know nothing about autism, so it is advisable that when you start session as a behavior therapist or a teacher, caregiver, anybody, when you start anything with a child, you have to make sure you get the child's attention first. Because without a child's attention, you can never get the child do other activities you want the child to do or engage in. So when you are telling the child to, you want to tell the child to write, so write, you make sure the child is having eye contact on the picture or the visual, write, write. So that is how we do it. And also we encourage some communication method like the PECS. So when I said PECS, it is picture exchange communication system and sign languages. So picture exchange communication too. I want to use these examples. This one as examples. So we have this one, a child playing, a child drinking water, and a child singing. So we are going with the PECS. We are using picture exchange communication system. All these things, maybe, for example, it has to be on the table. We are having a session with the child or in the class or where the child is sitting. So when the child wants to play or wants to drink water, the child will take a picture of a baby drinking water, give it to you. The child has communicated something to you that he or she wants to drink water or wants water. Then you take water for the child, or you ask the child to go for water. Or you ask the child to go for water. Maybe the child wants to play. Then the child will take a picture of a baby playing and gives it to you. The child is communicating something to you that he or she wants to play. Then you allow the child to what? Play. And also sign language. We teach basic sign language, especially those who are not vocal, to be able to communicate with you. Maybe you've given the child food, the child wants more of the food and doesn't know how to. So you just teach a sign language. You ask the child, this is more. Sometimes the food is just on the table. The child quickly grabs it. You take it from the child. You put it down, then you help the child, you hold the child's hand and sign for more. I want more, more. Then you see the child, then you give the food to the child. So that is how we do. We do it. So you can use sign language to also communicate with the child. So this is not in my slide, but I want to say when you are having session or a lot of autistic individuals or children have issues with attention, or some of them are attention, they have this disorder, attention deficit hyperactive disorder. So when and some of them are not able to sit down for long. So when you're having session or you're learning with a child, you have to make sure you have a timer. Sorry, I don't have my timer here, but you have to make sure you have a timer. So maybe you set your timer 5 minutes. After 5 minutes, you have to allow the child go on a break for maybe 2 or 3 minutes, then the child comes back. You don't have to keep the child in a particular place for like 10, 15 minutes. It becomes very difficult. The child will start throwing tantrums and all that. So maybe you get your timer, you set it 5 minutes. So you engage the child for 5 minutes and immediately the time is up. Make sure you give the child a break. The break doesn't mean maybe you allow the child stand up and go out or something. The child can still be sitting down, but you give what the child likes doing. Maybe the child has a favorite toy. You can just give it to the child to play with it. And after 2 minutes, your timer, maybe you're giving the child 2 minutes. After 2 minutes, when the timer is shrinking, you communicate to the child, time up, playtime, all done. Then it goes with an action, playtime, all done, for the child to know that it is time to go back to business. And also reinforcement strategies. Let's look at another strategy to support positive behavior. We have the reinforcement strategy. Positive reinforcement, reward good behavior with praise, preferred activities, or token. So when the child engages in a preferred, when the child puts up a preferred behavior, you need to reinforce the child immediately. We say immediately because we want the child to understand that this is why you've rewarded the child or reinforced it. So the child will repeat it another time. For example, you ask the child to sit down. Mina, sit down. And the child sat down. Immediately, you can give a hug. You can give high five. That's my baby boy. Awesome. Good job. You can say all these things to the child. But we always discourage kissing the child and also giving edibles to the child. Sometimes some people use edibles like calipo, toffees as reinforcement strategies for the child, but we always discourage that because we want to do away with edibles. We want to use the good job, the high fives, the hugs, and all that to reinforce behavior. Also, let's avoid, we have to avoid unintentional reinforcement of negative behavior. Unintentional reinforcement of negative behavior. So, example, giving a child a treat to stop crying. Maybe you took this toy from the child. Let's assume this is a toy. You took it from the child because you are having an activity or learning with the child, and the child starts crying. You don't give the toy back to the child because the child is crying. When you do that, you are communicating to the child that what he or she is doing is a good behavior, or the child is putting up a good behavior. Instead of you giving it to the child, you have to let the child understand that no, it is not time to play. You have to get this has to be done before you play. And a lot of the times when they are denied of what they want to do, they throw tantrums. That one is not meltdown, but first of all, you need to make sure it is actually tantrums they are throwing. A lot of them, it is tantrum that they throw. When you take something, a desirable item from them, they throw tantrums, but immediately you give it back to them, they keep quiet and start jubilating. You could see from their face. So you have to make sure you get the child do the activity you want him or her to do before you give it back to. So you shouldn't reinforce any negative behavior. The child is crying and you are giving it back to the child. You are telling the child that the crying is okay. The crying is an acceptable behavior. So next time when the child needs something, the child will cry because the child knows that after crying, Mina will give the toy to me. Now let's look at some strategies for managing challenging behaviors. Some strategies for managing challenging behaviors. Identify triggers and modify the environment. So as I said in my previous slide, some of the children are very sensitive to noise, light, texture, and all that. So I didn't talk much about the texture. So sometimes if you've noticed, when you give food to an autistic child, you see that sometimes they hold the food, they feel it before they eat. Some of them will smell it before they eat. So sometimes when they hold it and they are sensitive to the texture of the food, they don't. They will just leave it. Please hope you can all hear me.
So we can.
Okay, thank you. So they are very sensitive to texture. So they hold the food, they feel it before eating. Sometimes they don't eat it. Sometimes they smell the food. If they don't like it, they don't eat it. You don't have to force the child. You don't have to force the child to do so. And sometimes you have to, when you find yourself and the child finds him or herself in an environment where there are lots of noise, it's either you take the child out of the place because the child is very sensitive to noise, or you make sure you reduce the noise in that environment. And sometimes when there's noise in the room or environment, you see them walking up and down, walking up and down. Some will just cover their ears. They don't want to hear anything, they cover their ears. You don't have to force to remove the person's hand. No, it should give you a signal. That also comes with you knowing your child very well. Know your child very well as a mother, as a teacher, as a caregiver, as a therapist. Know your child very well and know what your child is very sensitive to. Know what your child is very sensitive. So immediately you see the child has covered his or her ear, then it gives you a signal that the child is very sensitive to noise. So you need to take the child out of the place. And also teach replacement behaviors. So if a child hates you when frustrated, teach them to use a calm down signal or words instead. So maybe the child is frustrated, trying to communicate something to you and not getting it. The child is hitting you, hitting you, hitting you, hitting you. You don't have to be in a hurry to just shout at the child to stop. No. You hold the child's hand. Then you say, no, you tap me. You tap me. You don't hit. You don't hit. We don't beat autistic children. We don't beat autistic children. So we communicate a lot to them. You hold their hand, no hitting. No hitting. With an action, no hitting. Then you redirect the behavior of the child. And also another example is a child wants attention and maybe starts crying, the child is on the floor and all that. or the child comes to just hit you just for attention. You hold the child's hand and no hitting. You tap for attention. Then you hold the child's hand and tap on your shoulder. This is how we tap for attention. You tap for attention. Then now you respond to the child. Now you stay calm and also be consistent. So when the child is frustrating and doing all these things or displaying all these behaviors, you don't also have to be frustrated, else things will escalate. You have to calm down and try to understand why behind the behavior, why the child is engaging in such a behavior. Please, I've seen somebody's hand up. I'll finish very soon so that questions and answers, time for questions, and I'll allow people to ask their questions. Thank you. So let's look at some real life scenarios and response strategies we can use. Scenario 1, a child refuses to eat certain food. What could be the possible cause? Maybe it could be sensory sensitivity to texture. Like I said previously, sometimes when they hold food, they feel it before. Sometimes they even smell it before they eat. So when the child is refusing to eat that food, you don't have to force the child. But what behavioral strategy can you put in place? Introduce new food gradually with positive reinforcements. You don't have to force the child to eat it by force. Yesterday, Miss Ashley said it. You don't have to force the child to eat it by force. You have to introduce new food gradually with positive reinforcement. Maybe the child doesn't want to eat banku and there's rice. You introduce the rice gradually, then you reinforce. Good job for eating this one spoon. That's my boy. Another one. That say positive, reinforce the behavior, reinforce the action for the child to eat more. Scenario 2, a child has a meltdown in a crowded place. What could be the possible cause? That is sensory overload. As I mentioned earlier, maybe the child finds him or herself in an environment where there's a lot of noise, or in a room where the light is on. The child is very sensitive to light or the noise. What do? You provide noise counseling, headphones, or take breaks, or use quiet space for the child to feel okay. Scenario 3, a child runs away when excited. What could be the possible cause for the child running away? So the possible cause could be lack of awareness of danger. The child doesn't know that when he or she is running, he or she can get hurt. So what do? You teach the child, stop, wait, or through visual and verbal cues. So maybe if you have a picture of a baby running and the person has stopped, or a baby standing, you just stop, then you wait, stop. But sometimes maybe you've gone for a program and this happens. So we mostly advise that know your child very well. If you think your child is very, 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 very aggressive and you can't take the child to certain places, please don't commit yourself. But when you go with the child too, make sure you are holding the child. Some of them too don't like it when you hold them too much. They don't like it. When you hold them for like 2-3 minutes, it becomes an issue. So I don't know how I will demonstrate that here for you, but there's a way of holding the child. If the person doesn't want you to hold his or her hand, there's a way of guiding the child when you are working with the child, so that in case the child wants to run, you'll be able to grab him or her. Now, behind every autistic child is a mother, a father, a teacher, a caregiver struggling or facing silent battles. How can we, or what can we do to support such individuals? So caring for autistic children can be emotionally and physical draining. For example, you're even going to work. You don't feel like going to work. We are even thinking something has happened in the house. You are going, but you still have to go to work. With these children, you have to be emotionally strong before physically fit, because there are some activities that needs you to run, to jump with the child, to do a lot of things with the child. So caring for an autistic child can be emotionally and physical demanding. So, and another thing is self-care. It is important to take breaks, seek for support from family, and connect with other caregivers. You have to connect with other caregivers. And the last thing is you need to join support groups, seek guidance and all that. So I have a support group where I have two support groups. One is for parents alone, and the other support community is for caregivers or teachers, caregivers or teachers. So we share ideas, that we encourage each other on the platform or in the community. We have other specialists or therapists on board, as a teacher or a therapist. You go to work, help it in the community or the group, then immediately somebody will answer or help you on how to. After this discussion, I will send a Google form to David to share it in the group. So if you want to join, you can join. It's for free. We don't take anything. We are just there to encourage each other, to help each other, to know that we are not in this alone. People are also in it. How people are doing it, you also learn from, you also encourage somebody, you also put, like, we are there to support each other. So thank you so much. And if you have any question, you can put up your hand to ask the questions for us to address it. Thank you, David.
Thank you. Thank you very much, Madam Mina Mokani, and a lovely presentation out there. In fact, we are really inspired and we are really inclined. All right, so we will take some questions if you have any questions for Madam Mina. Okay, so if you have any question, let me just see your reaction in the participation. Madam Mina, you're saying something?
No, I was saying that they can ask any question, even if it is not in the slide. If I know, I would answer them.
That's beautiful. All right, so as you rightly heard, you can ask any question at all with regards to what you're experiencing at home with your child, what you're experiencing in school. Okay, so Mr. Francis, you can unmute yourself and ask your question.
Hello.
Hello, Mr. Francis.
Yeah,
Good evening.
yeah, Madam Mina, thank you very much for a very insightful presentation. I think this is a ready to go presentation for us in the classroom. My question is, most of the times, our learners and their parents, at times, we need to have a relationship between these two. And at times, you see these meltdowns as you have espoused here. But at times, when you try to let parents know, they feel reluctant to cooperate with the teachers so that whatever challenge their children or their ward is going through, so that you also, the little understanding or the little knowledge you have, you also very difficult. They don't want to accept that their child is facilitators. So what do we do when you see those challenges? You need to at times maybe we try our best to let the child know some of the examples you have given, but to the parents back at home, so that they also take the initiative and also be helping that child. There's no such collaboration very effective. So I want to find out what other alternatives can we do so that will help parents as well and the world. Thank you very much.
Okay, so this challenge is everywhere. Thank you so much. And first of all, if your school is an inclusive school, I think you need to get rules and regulations, especially for the special children or the autistic child. So there should be times where you have meetings with the parents or counseling with the parents. You invite maybe, and with this therapy thing, the help and everything, you can't do it alone, or you don't have to do it alone. First of all, we involve parents, the plans and the reinforcement you use at school and everything. we let the parents know this is what we are doing. So also do this at home. Sometimes when you are very observant as a teacher, as a caregiver, as a therapist and all that, when they are doing it at home, you can see you see the rapid progress. But when they are not doing, you see. So you question them, okay, this is what I'm seeing, or this is what is happening. What do you think? But if the parent is feeling reluctant to listen to you. I think you have a headmistress or a head teacher in your school. Report to your headmistress or your head teacher so that later they don't come to hold you responsible on the at the you write the date. So maybe today 8th May 2015 at exactly 2:15 I called Asimasi's mom or dad to engage the person this that. You have to record all these things down so that you don't feel anytime or one day when they start to accuse you of something, you can refer them to, but you need to report to your headmaster or your head teacher. This is what you are seeing. This is what you've spoken or you've asked the parent, but they are feeling reluctant to. So if something is to happen, you are doing your best. If something is to happen, then you can't be held responsible because you've tried your possible best and they are still not adhering to. So now it is up to the school authority or the headmistress or the headmaster to take it up there. I'm sure when the headmaster or headmistress calls them, they will come. So that is what I can say on this, or that is what we can do. We all have these challenges. We all have these challenges at school.
Okay, thank you very much, Madam Mina. So we'll take Madam Susan. Madam Susan Fosua. You can unmute yourself and ask your question, Madam Susan.
Yeah, hello, please. Can you hear me?
Yes, please. We can hear you. Good
Yes.
evening.
Yes, good evening. Thanks for the presentation. Please, I wanted to find out, are there some chemical reactions or foods that triggers meltdown and some behavioral changes in children with autism? And also, are there some drugs or suppressants that can be given to them to keep them a bit calm? I'd want to know whether they can be allergic to some foods which will trigger some of their actions. Thank you very much.
Thank you, ma'am.
So yes, some of them are allergic to some food. So first of all, before we even come in as therapists, we ask you, have you been to the hospital? If no, we encourage you to go to the hospital to be diagnosed. So with the food and all that, the hospital will tell you, or the dietitian, whoever is in charge, will let you know what the child has to eat and not to eat. But sugar, so sometimes we come and we say that this child is very hyper. This child is very hyper. Then this one adding too much sugar. We don't give sugary food to autistic kids. It makes them very hyper. Sugar, we don't give sugar to autistic kids. It makes them very hyper. Some are allergic to food, certain food. Some are very allergic to certain food. I've worked with some children, they don't take corn. A lot of things they don't take because it was diagnosed or it was given to them. It was given to them at the hospital and they know why. And of course, drugs, there are some autistic children who are on drugs, especially some of them are very hyper and all that. So there are certain drugs they give to them, but we don't give it. It's the hospital. So we work together with the person's doctor, the parents. It's a collective or a teamwork. It's a teamwork. So sometimes we go for sessions and their drugs are in their bag. And we know that at 2 p.m., we need to give that drug to the child. We do it. So yes, they can be allergic to certain food. They can be on drugs and sugar. We don't give sugary food to autistic kids because it can make them very hyper.
Thank you very much, Madam Mina. All right, so Madam Tessa, you can unmute yourself. Madam Tasha, okay.
Yeah, please can you hear me?
Yes, please, we can hear you. Good evening.
Good evening. So please, I don't know if you touched on it, but I would want to find out when it comes to their schooling or their education, do you think it is necessary or autistic kids should be isolated from the regular kids in class so that they can be given special care, or it's okay to mix them with the regular students in class?
Okay. So we advocate for inclusive. So yes, we advise they be in the midst of other children. Why do we say that? Or why do we advocate for inclusive? We do that because we believe or we know that children learn from imitation. Children learn from imitation. So when they are in the midst of other kids, there are certain behaviors the other kids put up, which they can also learn from. And you as the caregiver, you as a teacher, you as a therapist too, it makes you know some challenging behaviors when the child is in the midst of people or other children. They put up certain behaviors, challenging behaviors that will let you know, no, you have to work on this. Take notice of it. Okay, this is a challenging, so I need to work on it for the child to put up a behavior which is accepted. So yes, it is advisable for the child to be in in the midst of other children. But in some cases, let me see, maybe for example, a child is 11 years, 12 years, has never had any therapy session before, has never been on any therapy before. And this will be the first, or this is the first time the child is having or going to school, even school. It becomes, when the child is even hyper or has ADHD, it becomes worse. So we advise that the child would stay home and take some therapy for some time for the child to calm down, work on their attention first. Things are a bit okay before you take the child to school. So in some cases, we do advise that the child will stay home, have some therapy sessions for certain things to be worked on before the child will come to school. So yeah.
Right. Thank you, Madam Mina. So, Madam Queen Emma, you can unmute yourself and ask your question.
Hello, good evening.
Good evening.
Please, can you hear me?
Sure.
Okay. So, please, I have an autistic child in my class, and she's just 2 years old. Today, I experienced something from her. She could cry, you give her this, she'll cry, you give her food, she'll cry. She can cry for like 3 hours in the stop. So, my question is, when something like that happens, what should I do to stop her
Can
from
you
crying?
repeat the
Because
question?
sometimes it can be so challenging. Should I come again?
Yes, if you can come again, I really appreciate.
Okay, I said I have a learner in my class. She's autistic and she's just 2 years old. And sometimes she can
How is
come
that
to school.
child?
I said, please can you hear me?
Yes, we
Yes,
can hear you.
I was asking whether the child has been diagnosed.
Yes, please. Yes, please. She has.
Please
And
continue.
she can come to school and she can cry the whole day. You give her food, you carry her, you do this, do that. She will just cry fast. I want to know what can I do when I'm in that situation to help her to stop crying.
So I understand the why. I said just like the why behind the action or the behavior the child is putting in. Like I said, some of them are very sensitive to light, noise, texture, and all that. Maybe the child is very sensitive. Just maybe, I'm not saying that is the case, but maybe the child is very sensitive to an environment where there are a lot of noise or light, or a room where there's light. You need to understand the why. That is why the ABC model of behavior is very important. The antecedent, what happens before the child starts crying. What happens before the child starts crying? So you need to understand the why, and you need to observe the child, study the child, and know why, the why behind it. Is it that the child doesn't like an environment? Have you tried taking the child to a separate class where nobody is there or something and the child is still crying? Have you tried putting off light? Because 2 years, the child cannot communicate to you. Is the child vocal or non-vocal? Hi, Quinn. Okay, so
Hello. Hello, please, I'm there.
yes,
She's
I was saying that
non-verbal.
she's
She's non-verbal, but
oh she's not
she's
she's
not
non-verbal.
trying
Good. Like
to. So one
so
thing that
it becomes
I've seen is that allergic to hot room. So when
she's
the place
allergic
is
to.
hot, I just remove the dress.
So you've observed that the child is very allergic
Hot,
to.
and she's sweating. She can cry. So that one, come again.
Yeah, David, please can you repeat what she said for me?
I'm
I'm
also
trying.
finding difficulty in getting her question. So, Queen, please reconstruct your question in the chat room
Yes,
and I'll read it out, okay? So that we'll know clearly what you want to find out and then she will answer that for you, okay? All right. So, let's take Oluwasan. Oluwasan, please. I saw your hand up if you can. Madam Oluwasan. All right, so you can unmute yourself and then ask your question. Madam Oluwasan.
Okay, good evening. My name is Oluwaseun.
Oluwaseun.
Yes,
Oh, Biko Biano.
no problem.
All right.
Thank you. So my question is, I have a child that I work with, and the mom complained to me because I just work with him at home, and the mom complained to me that in school he doesn't like playing with his friends, especially when they go to the playground and maybe they are to play on the trampoline, something that requires him to jump or like she showed me a video of them on the playground where others were jumping on the trampoline, and when he was inside he was just crying, and that's how he always does. So in that kind of situation, what could be done to at least take away that phobia and the child can also play like other children? Thank you.
Thank you so much. So, because I cannot mention your name, I'm not going to mention. So, first of all, the mother has told you that in school, this is the behavior the child puts in. I will advise that if possible, you also make time to go there and observe the child. That would also give you the why behind that behavior. Is it that the child is sensitive to noise? The child doesn't like noise. See, when kids are in the trampoline playing, there's a lot of noise, jumping, pushing each other, and all that. Some feel uncomfortable in that situation. So you just don't have to do a hearsay. You need to go to the school, observe it for yourself, observe it for yourself, and as we said, after observing it, if that is still the issue, you start introducing the child to it a bit gradually. So maybe when you're having session with the child, you can also opt to maybe once a while do a session with the child in school. So maybe when you start introducing the child to it gradually, gradually. If you don't do that, it becomes very difficult. Maybe after having a session with the child, you go with the child alone for the starts. Then you put the child in the trampoline. Then you be with the child, just engage, play with it. Wow, hey, the trampoline is nice. Can we jump together? Can we do this together? Gradually, gradually. Then you start increasing. You bring one child in addition to your baby or your child. With time, you be increasing. You see that the child will be used to it. Maybe they just take the child straight to it, and you see they are on a very strict routine. For all you know, in the house, the child doesn't go anywhere. So that is one challenge sometimes we have with some parents too. They don't allow the children go anywhere, no playground, nothing. So it becomes very difficult for them to be in such an environment in school, because in the house they don't do that. They are always alone, they are always in the room, nothing. They don't even go out to see what is going on outside. So I would advise that you go to the school, you make time to go to the school, observe it for yourself, and know the why behind the behavior the child is putting up when she's in the midst of her friends or something. You get to know whether it is because of the noise or all that. Then you start introducing the child to it gradually.
Right, thank you very much. So we move on to Madam Janet. Madam Janet, you can unmute yourself.
Hi.
Hello, good evening. We can hear you.
Hello, good evening. Thank you very much. And please, my question is about the food allergies.
Okay.
I think there are some parents who don't even know the food their children are allergic to. For instance, I have a client who doesn't know, should I say, the number of foods that the child is allergic to. And then she keeps changing the food each and every time. And he's always hyper. So I think I try to, let's say, advise her to take the child to the hospital for them to check so that we can know which food to give and not to give him. Because I don't know, the child is always hyper every day, morning, afternoon, evening. I'm even told before he sleeps in the night, it's very difficult. I think today I had an experience that I didn't even like at all, but I couldn't talk much about it because I've complained severally. He was given decent right plantain today. I think he was fine. After eating the beans, everything was messy. We were supposed to have a session and then it was an hour session. I can beat my chest and say I didn't get him to sit down for like even 10 minutes. So I was continuing, like I asked the mother, have you noticed, maybe apart from today, have you ever given him this to eat and then he was this hyper? Then she couldn't even answer. So I want to know if, I don't know, if there can be a medication on it for the parents to maybe take it seriously and then go to the hospital for those things to be known, or I don't know what else can be done for them to, should I say, in quotes, be really serious with their children, but most of the parents are not really serious with their children. Some of them don't even have time for them. They know since I have a facilitator or a therapist handling my child, then that's all. They don't have time for the children. Not, they don't know anything about the children. So please, I'm requesting. And I don't really know what else to do again. So I'm requesting if there should be an education for them or yeah, that's the concern and question. Thank you very much.
David, please, can you, if you heard her clearly, can you tell me what she said? I only heard why she said she couldn't even get a child to sit for like 10 minutes when they had a class or something like that. And I also heard where she said some parents are not concerned about their children because they feel they have needs and all that. What was it?
Yeah, so I think in general, she has an hyperactive child in the class, okay, and then the child is having difficulty paying attention, and then also getting the parents to be involved with regards to how to help the child. It's a difficulty for her. So I mean, she wants an insight over that.
Okay, please, first of all, please, are you a therapist or you a teacher or something?
Please, I'm a facilitator.
You're a facilitator. Please, when you started, did you first work on his attention, the child's attention first?
Yes, we are still working on that attention too.
Okay. Okay, so we are maybe after that you take my number, but I wanted to ask what level are you now when it comes to the attention? Are you still at
Okay.
level one? Or yeah, I hope you get me when I say the levels, you understand what I mean by the level.
Yes. Yes.
Yes. So because the attention, you've not gotten to maintenance. The child hasn't gotten to maintenance. The child still has issues with attention. So you need to work on the attention first. The second thing is, so children who are very hyper like this, you don't keep them or make them sit for a very long time. 10 minutes is too much for the child. 10 minutes is too, even some of them, 5 minutes is too much for the child. So the child will sit for like 2, 3 minutes. You give the child a break. Then the child will come back again set, then gradually you'll be increasing the time. You'll be increasing. Yeah, we also have that challenges that parents feel you have a therapist, you have a nanny, they have a nanny, or you, the therapist, you, the facilitator. That is it. You should do everything. But let me tell you, a parent who also want to see progress in the child will also be there, passively be involved. When you talk to the parents, if they are still not doing anything, you've said it, you are still saying they are still not doing anything. Just do your part. Do your part. And pray. Hope that they will listen to you. Because at the end of the day, you can't force them. They feel like I'm paying you, so what are you doing? Okay. Because without their attention, you can never get the child to do anything. So still work on their attention. After that, you can take my number from David. Can take my number from if you hate me. Maybe we can look at what you are using to work on the attention. If we need to adjust, I need to find out certain questions from you. If we need to adjust or we need to change the program for the child, the attention, how we are going about it, we will do it together so that we start that one and see how it goes. So we first of all need to work on that. So you can take my number, David, after the discussion so that we talk from there.
Okay, please. Thank you very much.
Welcome. Thank you very much as well. So on that note, don't worry, I'm going to put her contact and every other details of her in to send it to all of you. So if you need any help, we can also hit her up. All right. So Madam Philomena Nketia, sorry, Nanteti, sorry. Madam Philomena Nanteti, you can unmute yourself and ask the question.
Hello, good evening.
Hello, good evening.
Please, I'm Philomena. I'm a teacher, and I have this boy in my class, which are having to take care of him in the school as a teacher and after school in the house as a caregiver. He's somebody that doesn't like food, but when you force him and put food in his mouth, he will swallow the food and even lick his lip. So that that has encouraged me to keep forcing him to eat. And when I do that, he eat the food. But if I don't do that, the whole day he can go around without eating. And sometimes I get scared that maybe something will happen to him, and the parents will question that, has he not been eating? So that has also pushed me to force him to eat. And sometimes when he comes to school in the morning, he will be okay going about doing his own thing. He normally doesn't like playing with other kids. He always wants to do things on his own. And then when he gets tired, you will see him go and lie down. He can sleep from morning 9 till 2 we close. Then sometimes if the parents are coming for him, he's still sleeping. So if I'm not lucky to feed him in the morning, that means the whole day he will not eat. And then he will go home. And when I go home and take care of him, sometimes he'll be still sleeping. So 11 that I leave the house, and he will wake up around 11:30 to 12. He will not sleep till the next day that he will come to school. Then he will come and sleep in the school. So I talked to the parent that the behavior is not normal for a child to behave that way. But please, so the father is a pastor, so he always says that God will do it. But for 3 years he cannot talk. He only talk when I force him to do something and he doesn't like it, and he will say ma. The only thing that he can say is ma. And 3 years now, I have other kids in my class. 1 year, 6 months, they can talk, they can point out, they can they can sing rhyme with me. And here comes the boy that I'm that close to. He can't do anything. And I'm scared to tell the parent that what the child is doing, like his behavior shows that he is an autism. I'm scared to tell them because I don't know how they will take it. That's their first child and their only child. So I want to know in which way can I communicate with the parent for them to come in to help the child, because 3 years he can't do anything. Thank you.
Thank you very much. So, Mina, if you're there, Mina, are you there? Mina, are you there?
Sorry. So I thought I had unmuted myself. I was saying at a point I went off, and at a point her line was breaking. So if you can summarize it for me, I heard where she said she's scared to communicate all those behaviors to the parents, and also the child doesn't eat. She has to force the child to eat before, and the child will lick his or her mouth. I don't know. So if you can summarize it for me, I
Yeah,
went
sure.
off.
That is what she wants to know. And then also getting the child food to eat. The child will eat, but then she has to force the child to eat. And then also the child can the only word the child can say as at now is yes, ma. But the child is around 3 years of age. And then her fear is that she would want to spell out that the child is autistic because that's the only child of the parents and the first child as well. So what can she do?
Okay, so you can't confirm that the child is an autistic child, first of all. And you don't have to be scared. You don't have to be scared to communicate to the parents, whether it is their only child or not. Communicate what you've seen. Because a lot of parents don't even have time for their kids. They don't study their kids. They feel they have nannies, they have caregivers and all that. But you don't go to say that your child is an autistic child because of this, that. No, you don't say that. But rather, you let them know what you've observed. Encourage them to take the child to the hospital. I think every parent will be concerned if the child is not eating. Every parent will be concerned. So please let them know what you've observed. You write it. Sometimes, if it is allowed to take videos when you are trying to feed the child and the child is resisting, you have to force the child to eat and all that. You can take videos for evidence sake and show it or let the parents know that this is what is happening. So you think they have to take the child to the hospital for a psychologist to assess the child and see what the issue could be. If you are also scared, you can talk to your headmaster or your headmistress. You let the headmistress or the headmaster know what you've observed for some period now. This is what you've observed about the child, and you know that maybe at the age of 3, the child should be able to respond to his or her name, the child to be able to do this, and the child is not doing all these things. So you feel there's something wrong. So can the headmaster or headmistress invite the parents to talk to them, to take the child to the hospital? But you don't go to tell them, or the headmaster doesn't just tell them that, oh, your child is an autistic child. Every parent will be angry. You can't just say that. Is it because of what you've seen? What if it is a different condition? How will you know? So you advise them to take the child to the hospital. And every parent will be in denial. A lot of time, that is what we struggle with. They will be in denial for some time before. Sometimes it takes years before they come to accept that, yes, my child, especially those who have just one child or that's their only child, it takes a longer time before they come to understand that, yes, my child is a special child and needs help. So forcing the child to eat too, sometimes you don't know when. I'm not saying it will happen, but you don't know when the child will be choked and you regret doing that. So the best thing is, please communicate that to the parent that these are the things you've observed about the child. If you can't, the headmaster is there, the headmistress is there. Communicate to them. Let them know. If you can take evidence of what you are saying, present everything to them and let them invite the parent or the mother there to talk to them. This is what we've seen, and it is a problem. It is an issue. So we advise you take the child to the hospital for assessment, for maybe a psychologist to assess the child. Let us know what is wrong with the child. And based on that, we can handle the child. So that is what you can do. You can't go and just tell the parents stress for it that your child is an autistic child because of A, B, C, D. No, they'll be angry. You have to communicate to them that these are what you've seen, these are the behaviors you've seen of the child, and you think there's something wrong. So you would advise they take the child to the hospital for assessment so that they know what is wrong with the child. They diagnose the child, then we all know what to do with the child, and we all come up with some plan, or if we are to get a therapist or something like that, then we can help the child, because early intervention will go a long way to help. For how long will you keep mute about it? And I can see you are very passionate about this, because somebody would not even be bothered about it. And since you're passionate about it, this is what you can do to help. Please, forcing the child to eat is good. Sometimes children want attention. Now, maybe the child has gotten to know that anytime I deny eating of the food, she'll force me. And sometimes they enjoy doing that. Just like you'll be there, and a child will spit on you, and you react, and they feel like they see it as a joy, they see it as fun. So with time, you see, they will come and just spit on you because they know you react. Sometimes they do that for attention. But since we all don't know the condition and we've not diagnosed, I will advise you communicate what you've seen. If it is possible to get evidence, let them see it. Then they take the child to the hospital for further assessment and diagnose. Thank you so much. And please, you can, just like David said, I would like to follow up on that issue. You can take my number from David. You contact me. I'll follow up. We all see how best we can do or communicate to the parents to help on for them to take the child to the hospital. The earlier the better, so that we can help the child be able to fit into the society.
All right,
Thank you.
wonderful. So Rahel Bossa, you can unmute yourself and ask your question. Rahel.
Hello, good evening. Please, I'm
Hello, good
Rahel
evening. We can hear
Bosai.
you. Sure.
With the explanation you've given, I've come to understand most of the issues. But now my question is, I have a learner in my class. This boy always comes to school with animal. He really loved it. And the problem now is he sometimes, not sometimes, most of the times, imitates the animals, especially dog, monkey, cats. So my question is, will he ever come out of it, or it will be with him forever? Thank you.
All right. So the learner likes animals a lot. Have you tried to find out David, you are laughing. Have you tried to find out the why behind his love for animals? Of course, I believe he can stop with the right therapy given to him. So you need to know the why behind it. Have you engaged with the parents to know why that's behavior at home? Is it like you need to engage, you need to communicate with the parent? Like I said, you can't do it alone. You need to talk to the parent, know the why behind why the child likes those animals a lot. And yes, with a right therapy, so for us teachers, for us therapists and all that, we are basically in their lives to help them unlearn certain behavior and pick up the acceptable ones. So of course, it can be worked on, but it needs a plan. There's a whole plan, a structure on how to go about it. So you take my number from David. Like David said, he will put my number on the platform. Please, you can hit me up. We will take it from there. It can be worked on and can be worked on. And also, you have to communicate with the parent to know the why behind it. Know how the child relates, or how whether they expose when the child gets home, they just allow the child with the animals to play with the animals. That's the child's only friends or what. You need to find out all these things before we draw a structure or come up with a plan to help the child. So take my number and please, I'll be waiting. Hit me up so that we know how best to help that child.
Madam Gifty, you can unmute yourself and ask your question. Atuba Gifty.
Good evening.
Good evening, madam. We can hear you.
Thank you. Please, mine is about two of my autistic children in the class. One is an autistic child that this thing has affected his speech. He's not talking at all. And I'm a little bit disturbed because communicating with him is just difficult. Sometimes you talk to him, it seems he understands you, but when it comes to giving him instructions on things to do, it's not just flowing at all. And then the other one too 3 weeks to vacation last time. All of the sudden just changed. She's been aggressive, pushing and scratching everyone who comes around her. And for now, since we open now, I'm the only one who can go around. Even her mom is complaining at home. She wanted to just keep her home. I said keeping her at home too wouldn't help the situation. I want to know the way forward. The help I can maybe involve the mother we can give to change that because it has affected her. Last time she started writing, all of a sudden when this just came in, the writing is off. Thank
David,
you.
can you tell me everything she said? Summarize everything she said.
Okay,
Her voice.
so yeah, so she says she has difficulty with writing probably, and previously he used to write, but then all of a sudden everything is off, and then she's I think gone back to how she used to be. So how then can she support the child?
How was she previously? The question is, how was she previously? I think she was explaining, but I didn't get that. Her voice was like, how was she previously? Is it that did she change the child change after vacation or afterwards? Because sometimes when they go on a very long vacation or during vacation, you see, with this therapy, with this help, something, it's not only in school. You do it at school, and the parents also continue in the house. That is why we involve them. So when they go home and they are not getting that, sometimes they regress. And when they come back, you need to start all over again. You need to start all over again. So I heard her saying that she spoke to the mother and the mother was saying something. I didn't really get it.
Madam Gifty, you can come in again.
I'm saying it. She was just normal.
Okay.
Those aggressiveness, it just comes and then just let's say like 2 hours and it's gone. And it takes a long time, sometimes 3 months, 4 months, you wouldn't even see that at all. But
So please,
3 weeks to back.
okay, please, I'm sorry for cutting in. Is your child vocal? Is she vocal or not?
Yes. But with her vocal, it comes when she will communicate with. But when it comes to learning, everything moves on smoothly. Even though when you ask for response from her, you wouldn't get it, but she makes signs. Like when we are doing identification of letters and numbers, when you ask her, she wouldn't say it, but she points at it. When you ask for a picture, she points at the picture for you to know that she knows what you are saying and could even write from 1 to 5 on her own. But 3 weeks to vacation, it just happened all of a sudden, and she just off.
So, like I said, every behavior the child or an autistic child puts up, the person is trying to communicate something to you. And it is up to us to get to know the why behind that behavior. The why behind that behavior. Is it that she started being aggressive because of sensory, or is it for attention? You need to understand or know all these things. Or is it to escape from a task? Because sometimes they do that just to escape from a task. You want to get them to do something, and they start behaving in that manner just for you to say, okay, that's all. You've made them stop. Or they are doing that for to get something from you. So you need to understand all this. Is it for attention? Is it for sensory? Is it that the person finds him or herself in a place where he or she is not comfortable? So the person puts up certain behaviors just to calm him or herself down, like just to feel okay in that environment, just to a lot of things go on in their mind. A lot of things go on in their mind. A lot of things go in. So we have to understand the why behind it. Is it for attention? We need to assess to know whether it's for attention, whether it's because of sensory or anything. Like we need to find out all these things. So you need to please take my number and from David, please contact me. Please do well to contact me. I'll ask few questions about the child, because there are certain questions that are very private. You can't put it out there because of confidentiality and all that. We need to engage to know more, for me to know more about it. But you have to know that every behavior the child is putting up, the child is trying to communicate something to you. The child is trying to communicate something to you. Sometimes they don't just know how to communicate it to you, and they start throwing tantrums, they're aggressive and all that. So please take my number. Let's take it from there. We need to engage, get to know, ask some few questions, which can't be asked here because of confidentiality sake, so that we take it from there. I'll make time for all these people. Please take my time. Take my number, sorry, contact me, DM me, you can call me or text me. I'll make time. We will all, because every behavior of the child, there's a meaning or there's a reason to why the child is behaving in that way. And we are here to help. Behavior therapists, teachers, caregivers, that is our job. That is what we've signed up for. So we have to make time for that, and we have to help them. Yeah.
Wonderful. So, do kun Asha Dolapo. Please, you can
Dolapo.
Dolapo.
All
Wow,
right.
I had it right. All right.
Before Aisha comes in, sorry, before she comes in, so I said I would give you a Google form to put it in the group. So all these things, sometimes we discuss it in our community. People put it there. We have other specialists on the community. We have speech, we have some doctors on the platform, like the food things they were asking about like this on the platform. You just put it there, somebody will be quick to answer it for you and all that. So the Google form too, I also give it to David to put it on the platform, so that you fill it and just tap on the link and join, so that other tips you'll be getting it from there while I engage you to know about it. We go and how to go about all these things. Thank
Beautiful.
you. Sorry. Sure, you can come.
Okay, good evening.
Good.
Can you hear me, please?
Yes, please.
All right. I want to come from a much more broader perspective. I've been a little bit concerned about autistic children for a very long time. I began to observe that in the normal mainstream schools, initially we were not really seeing kids with autism. But for a long time now, let me say the past 10 years down the line, we've been having more kids being infused into the school with autism. Now, my challenge is that most of the schools are not well prepared to actually handle those kids, especially the public schools and some of the private schools. One, we don't even have the materials to deal with them. We don't have therapists. And you discover along the line that most of the parents that cannot even afford to have a caregiver end up putting these children in the house. They see them as a let me put in quote, a thing of shame, and they are taken off school. You see girls with autism getting pregnant early out of ignorance and a whole lot of issues. Now, my appeal is this, because you are doing a very good job. You are actually enlightening us on what to do and how to go about it. Is there a way that you can have therapists who can actually volunteer and go to the public schools, especially schools that we know that the parents cannot really afford to give their children proper care when it comes to autism, and have them go there maybe once in a month, even if it's just, how will I say it, in a cluster of schools around. You have a therapist coming in a particular school, and other schools are notified, and the schools can actually move the kids to those places, and we can have a therapist check them, a doctor check them, and from there we can actually have them improving. Then also, can we have materials for these schools? Because we can discuss it like this on a wide base, but the problem we're actually having at the grassroots will still not be addressed by the schools and the children. Then this awareness of autism, you see, in Africa, we term it as something very mysterious and supernatural, spiritual. So most parents don't even want to hear that their children have autism. They don't even want to know what you are saying. They would rather tell you, we are going to pray about it, trust the Lord for it, and stuff like that. And these children end up getting frustrated because nobody seems to really understand what they are going through. So can we have much more awareness programs in most of the public schools and also some of the private schools also, so that when we are having PTAs, we can invite people to come over, people like you to come and talk to us about autism and stuff like that. Because sincerely, I'm more concerned about parents that cannot afford to have caregivers, and you see most of these kids just wandering on the road, some being forced to take on vocations that they don't really even understand and they don't want, because over time they've grown and the parents don't really know what to do about them. Thank you. That's my question.
Thank you very much.
Thank you so much. Thank you so much. So before David, you comment on this, I want to also come. Thank you so much for raising this topic. I know last month was Autism Awareness Month. I saw David and his team did a massive job by creating the awareness. Of course, we we can't reach everywhere in this Ghana. So yes, that is what one thing my team and I are also working on, to start going to some schools to create the awareness advocate. So please, if you know of any school that you think we are working on it, we don't know all the schools. If you know some schools you think they need to hear about this, please contact me. Let me get the list of the schools. We will see how possible we can do. And also, we do advocate that government, that is why we do Autism Awareness Month, which is the April. We advocate, we tell the government to make policies that will include all these things, the media to also loud the awareness out there. And also why there's a lot of autistic children of late, we all can't tell, because we all know autism, the of autism, no specific cause of autism as at now. We only know factors that can contribute to that. So yes, it's a very good and all that. And also the caregivers you are talking about don't just go in. Some can fake that they are therapists. Some can fake that they are caregivers and all that. It is best you get a trained professional. It is best you get a trained professional who can handle it. Of course, sometimes it is difficult, it is expensive. I saw it in the group. Richmond or Richard was saying that it is very expensive to afford it, but not all of them. Not all of them are very expensive. Just DM me if you need any therapist, behavior therapist for your autistic child or your school or anything. Just DM me, we will talk. So yes, David, it's up to us. What can we do to loud it? Because as part of my project this year, my team and I, we are really working on it to start visiting schools, to start educating, even if it is going to the villages, to educate mothers, fathers on the what autism is all about, so that we do away with this perception that, oh, the person is not a human being, the person is from rivers, from trees, from, because I know of a certain village that an autistic child was buried alive because the priest in the village says that the child was from water, so they need to bury the child alive, and they did. And we went there to create awareness over there. It wasn't easy because we had to go with police, soldiers, because it was a whole lot of drama. It was a whole lot of drama. So my team and I are working on it. David, I think we need to talk after this, see how we can also collaborate to create more awareness, to just go and give tips, advocacy in the various schools. If we can get some sponsors to help purchase some of the items the school will need to help. And also, yes, we do beg that at least in every public school, there should be a therapist. We keep saying it as part of the Autism Awareness Month. We keep appealing to the government. and all that. But we can still do more. As we are here, we are a lot on this webinar. If I say it, you say it, this person says it, we are sending a message across. Somebody will hear. So yeah, please, as I said, take my number. My team and I are working on it this year. So you can DM me, let us know, and we also consider the schools you know, or if you know of any village, any town, or anywhere you think it is best for us to go. David and I will also talk. We will see how we can team up, we can collaborate. Maybe if it is twice every quarter, or like we will talk and know how best we can do to also help. It's just that, and also it's just another challenge is we the specialists in this field are very limited in this country. Very, very limited. Not all people have that passion for this job. So we will do our possible best. We will still continue creating awareness, the advocacy, everything, and see. I believe that with time, I think now people are really accepting it as compared to the previous years. Now people are understanding what autism is all about. People are accepting it. Last month, we were moving from just awareness to acceptance. So people are now accepting it, and let's keep telling people, let's keep creating the awareness. And I'm sure a few years to come, we will not have much of these challenges. So Madam Asha, please take my number, please contact me and let's talk. I also put up my team and I will consider it's something we are really working on this year. David and I will also talk and we will see how we can collaborate, seek for sponsorship to also help.
Beautiful. All right. So Galaxy, you can unmute yourself. Galaxy A20E. Galaxy A20E, you can unmute yourself and ask your question. Your hand is up. Okay. If you don't have Galaxy E20E, Annabella, you can unmute yourself and ask your question.
Okay, good evening.
Good evening.
And thank you for the education. Okay, I'm a facilitator of a school, and I think somewhere last year we had an advocacy on autism. So I closed from school and I was coming home, and the parents met, and she was like, the awareness of the autism has been widely spread, but what of that of the Down syndrome children also? I think we do not really hear about them. So I want to know if the autism and the Down syndrome are of the same, no, they are different. That's why we do not really hear about the Down syndrome, but we are always focused on the autism children. So that's what I want to know.
All right. Thank you very much, Madam
Thank you.
Annabelle.
All right.
Okay. So Mina, would you like to take it or should I take it?
Yeah, please repeat it. I was distracted a bit.
All
I was
right,
doing
so she want
something.
to find out
Repeat.
why is it that of late we have a day celebrating autism, and in April we all go around making advocacies and talking about autism spectrum disorder. Why is it so? And that we are not also mentioning other forms of disabilities or educational disabilities, like for instance, she gave an example of Down syndrome. Is it that there's a difference between the severity with Down syndrome is not that much in the country? Is it that we are not seeing them? And what is that? But then she wants to know why is it that we keep talking about autism and we talk less about Down syndrome and other needs as well.
Other conditions are equally also important. They are severe like autism. They are also severe like autism. And I think, David, why are we not louding that also? Why are we not louding that also? I think I'm louding autism because it's my field, and
That's
I'm not saying because that is it, I should only loud the autism. But I think there are other specialists in that field, and I'm sure they are also doing their best. It's just that maybe they are not louding it enough as we are doing. Of
okay.
course, since we are all in the same umbrella, we can all join hand in hand with them to also loud it. They are also severe. Even having ADHD alone and the person is not even an autistic child is a whole issue on its own. So I think we can also join hand in hand with them. And we can also get to know who those people are, understand those conditions a bit and see how we can also do what we can also do to help. But I think I allowed autism because it is my field. I'm not
Wonderful.
saying it's the right thing, but I think I allowed it because that is where my specialty is. And it is a great concern you raised. We all join in hand with those other specialists in the other way so that we can all loud it. We can all loud it
Sure,
out. That
that's
is what.
beautiful. That's beautiful. All right, so Madam Annabelle, the main reason why we mostly talk about autism and mostly talk less, okay? Not that, as Mina is saying, Down syndrome is being spoken of, other disabilities is being spoken of, but the main reason why autism has become the compound and we want it to become a more compound name is that with the Down syndrome, there are certain features that you are able to identify and also see at a glance. So, for instance, you see them in a particular form where you can able to tell that this particular student or this particular person is on a Down syndrome. But then, with regards to autism spectrum disorder, most of the time it is not visible. So, even extending help to them becomes late or becomes very
Yeah.
difficult at a point in time. So, we are hitting mostly with regards to autism so that you can understand that there are people who would not, because there's no sign of autism. I mean, what you can see is their characteristics, but then unless they portray those characteristics to a higher level, you are not able to tell whether someone is autistic or not. So we are trying to mention it louder and clear. But then also, I understand some people, some organizations are also, like for instance, let's talk about dyslexia. African Dyslexia Organization is also talking about dyslexia, talking massively about dyslexia.
I was about to come there. Yeah.
So, I mean, other organizations are also doing their possible best to hit on that. And thank you for the heads up. I mean, now I think we should be able to chip in those things as and when we meet.
Yeah. Maybe I think we have to also collaborate with them to loud
Exactly.
it as we loud the autism because they are all equally important for
Exactly.
people to know about it. And
Sure.
yeah.
Galaxy, I think you are now okay to unmute yourself. Galaxy A20E. Are you there? Sure.
Yes, please, I'm here.
All right, sure. Please, your name?
Sorry, I got, I'm Betty.
Betty. All right, sure.
Okay.
I actually got this thing yesterday evening, and but I have one child around here. She's almost 5 years. She doesn't speak at all. And when she was brought to the school, we were told that she is having a delayed speech. But there were one or two things we saw. One is she doesn't sit in class. She's always running. Speed. If you chase her, and while she's running, she'll be shouting. It has a very high pitch sound. And when she'll wee on herself. Poo-poo, if you don't quickly grab it or identify or see it quickly, she'll do it on herself. She will cry the way so now we are trying to see the way she cries, then maybe she's hungry or she wants to wee wee or she wants to drink water. So we will, okay, you give her water. If no, then it means you have to take her to the washroom. So we asked the parents now they said they have started therapy, but we are still not seeing anything. And most of the time when we say anything about the child, then they get offended. I want to help the girl. And I don't know how, because when you touch on this thing, the mom even got offended for about a term the child didn't come back. I want to know how best we can sit with such parents and help the child. As for her, she will write. Like there's nothing you can't even force her to sit down. So I want to find out what we can do to help both the child and the parent. Thank you.
Welcome.
I think the parents are still in the denial state because I think they're still in the denial state. And I know for schools, you have times that you invite parents. I don't know, is it called? Is it parent teachers?
PTA,
Yes. Or
Parent
I
Teachers
think
Association,
yes, and
or
sometimes I think
PTC.
when you notice something about the child, you don't even wait till it is PTA. You invite the parents into the
Yes.
school for the headmaster or headmistress to talk to them. So I think if you are saying and they are still denying, just like I was saying, then report to the headmaster or the head teacher, the headmistress to call them. Sometimes maybe our mode of communication. How do we communicate to them? Maybe sometimes how we
Yeah.
communicate them makes it difficult for them to accept or they feel offended. Maybe to you, you feel like you've said it in the rightful way, but to them, how they will take it is a different thing. So if you've tried and they are still not okay, I think you should communicate to the headmaster or headmistress to invite them to engage them in a conversation. Let them take the child back to the hospital for another assessment to get to know. So after they do that assessment, a psychologist run that assessment and diagnose the child. Then you can base on it to draw a plan on how to go about it. You can know what to target on, what to work on the child. So please, without the parents' permission, without their involvement, it will become very difficult for you to do it alone. Very, very difficult because you can do it in the school, and when they go home, they are not doing anything, and it looks like it's a cost 90 work you are doing. Or the progress becomes very slow because you are the only person doing it. And with children, when you're doing with autistic children, when you're doing it at school, they have to do it at home too. That is why sometimes we educate them, we give them, sometimes we give parents some individual learning plan or something like we draw something for them to also follow it at home. So, okay, maybe you are potty training the child or you are teaching the child how to eat. This is what you do in school. Then you communicate to the parents. Okay, so when the child comes home, if in the morning you are in a hurry to go to work and all that, it is okay, but in the evening, make time for the child to eat by him or herself. So if you've tried and they are still not, communicate that to the headmaster or the headmistress to talk to them, for them to take the child to the hospital for further assessment and diagnose. When that is done, then the hospital will now see, okay, it is about autism. The child is autistic child. The child is this. So you need a therapist. Maybe you need an AB, somebody who is trained in ABA, applied behavior analyst, to come in to support the child in this. And you need maybe a speech therapist to come in or something. Then based on that, you can look for the therapist, and the therapist will now draw a plan. You just don't go and start working on autistic child because, okay, you have the skills. There's a whole lot that goes into it after assessment. You need to sit down, get to know what you have to start to work on the child. You draw a plan, it's a whole lot. Then you track progress and all that. It's a whole lot. It's a whole something on its own. So please communicate that to the headmaster or headmistress. Let them invite. Maybe you have communicated it so well to them, but the way they took it is a different thing. So a second person should come in, or a third party should come in and communicate. That would be best done by the headmaster or headmistress. Sometimes they listen to them in quotes, or sometimes they give that reverence to them because they think, okay, the person is the owner of the school, or the person is the one taking care of the school. For them to take the child to the hospital for further assessment again and diagnose, and based on that, we can now see what we can do.
All right. Mr. Paul
Thank you.
Lubua. Yeah, I think I got it right. Mr. Paul.
Good evening.
Good evening, sir.
Good evening.
I'm Paul from Uganda.
Wow, thank you for joining.
I'm happy to be part of this webinar, and I thank everybody who has been with us since day one. My issue is about the talk has usually has concentrated on people of kids of early years, but I think we have a problem for people who did not get this diagnosis early, and like my son is now 19, and we have been in a normal school, what you call public school, for all those years. Now attending what you call high school. But the teachers in Uganda have not as aware as I'm now learning from the Ghana people. You are at least a step ahead. So my issue is it like you cannot teach old new tricks to a dog, to an old dog? What are you considering for people who have at least in their teens? Because what I hear from many of the people speaking, responding, are like these are early years, like preschool, primary. What can we do for those who are at least in other years, the teens especially, so that they are also helped? Because I recently appeared in one of the newspapers here in Uganda, the national newspaper, and I was kind of raising the same issue that the teachers are not aware yet. These guys are moving on, but they are not being helped the same way maybe the toddlers are being helped. I thank you. Maybe I think you have. I guess you have got my concern.
Sure.
Thank you.
Please,
Thank you.
can you
All right.
summarize it?
Okay, so he wants to know if there are any interventions you can give to a child who is above a preschool age. Most of it, all the comments that he has heard so far are kids around the preschool, and they are mostly below the age of 6. So if you have a child who is above the age of 6 or probably in the teens, how are some of the things you can work on to help a particular child in that regard? And then also, he spoke about the fact that Ghana is way ahead with regards to autism awareness as compared to his current location. So, in that case, what can he do?
Yeah, so we can still help a child who is a teenager and is an autistic person. Yes, we can still help. So when you ask that, what can we do to help the child after diagnose, you need to get after diagnose, we need to sit down and observe. So after diagnosis, we do assessments, you do observation. You get to know the child's behavior in an environment when the child is in the midst of his or her friends and all that, and based on it, you use to draw your plan. So right now I can't tell you that when you do this with the child, do A, B, C, D with the child, because I've not seen the child. I haven't observed the child. I've not seen the medical report, the diagnosis and everything of the child. So I can't tell you that do A, B, C with the child and the child is going to respond or not. But I know the child can be worked on. It is never too late. It is never too late. And we all know that autism is not cured. It can just be managed. So since it can be managed, we can still manage that 19 years old boy. We can still manage it. But I can't tell you do this, do that, do that. I have to know, probably I have to engage, get to know the challenges of the child and all that, because I'm not seeing the child, I have not observed the child, and I can't say when you go do A, B, C with a child. I think if you get a therapist over there, if you get any therapist over there, not just anyone, that they trained ones, they'll be able to help. It is never too late, Daddy. It is never too late. Don't be worried. The child cannot be worked on. The child can be managed. Just that it will take time. We know all these things. It takes time, patience. The child, you see progress. But if you want to see changes in just a day or 2, 3 weeks, 1 month, it is not possible, especially where the child has got into. It will take time before, and it depends on the inputs the parent will also put in, how the parent will also support together with the therapist or the teacher or the facilitator. But the child can be managed. It is very possible. And thank you so much for commending Ghana that we are leading when it comes to this autism awareness thing. We thank you so much. Ghana, we are doing our best. We are doing our best to
Yeah,
put
we'll
it
come to
out
Uganda
there.
very soon. Don't worry, sir.
Yes, we
Yes.
are praying. I'm also hoping that one day we'll come to Uganda, yes, to also create awareness there. If you host us, we'll come. Just let us know. Put things in place, invite us, we will come. But the child, on the more serious note, the child can be worked on. The child can be managed. It's never too late. It's never
Sure.
too late.
Mina, add this one to your itinerary. Next year we're going to Uganda. So we'll connect. Yes.
Okay, okay,
So
okay.
we'll connect with Mr. Paul and then we hit up. All right. So
Okay, so I think get his number. I'll take his number from you as well, and you can give mine to him as well. We will
that's
talk.
fine.
We will
All
know.
right, sure. So Mr. Paul, also you can now that we haven't assessed the child yet and we don't know what the child does
Exactly.
and what level the child is, what you can do is that now look at the positive aspects. What is he doing best? What is he being? What has he been able to achieve? And leverage on the positive side, okay, and then get him to do other things. All right. I think that is
Okay.
the general thing you can work on that.
And Mr. Paul, please, you can also take my number. You can engage with me. You can engage with David too. We all can join hand. Maybe you tell us these are the behaviors the child is putting up, and you don't know what to do. We can come in to give some tips, and also with the community I talked about, with the parent community. When the form is being, kindly fill it and join the platform as well. We will learn from you. You also learn from us. There are other specialists on the community who also will give you some tips on how to work on the child. So we will stay in touch, Mr. Paul. Now I'll take your number and
Beautiful.
I'll let him give my.
All right. Let's have Cynthia Awache. You can unmute yourself and ask your question. Our time is
Okay, good
almost up.
evening.
Yes, our time is almost up. So this will happen to be our last question, and then we wrap up. Cynthia.
Good evening, everyone.
Good
I'm
evening.
Cynthia. My question is, I have this learner in my class. She can't talk and she can't sit at one place. She's 7 years now. My problem is that how can I help her to hold a pencil and write? Thank you.
Okay. All right. How can you help her to hold the pencil and write? All right. So, Cynthia, I don't know if Mina want to take this, but
Please let me hear the question first, then you come in with your
okay. So she's saying
input.
that she has a child who is hyperactive and also non-verbal. Yeah, but then
Yeah.
also she wants to get a child to write, but the child is not able
Yeah.
to. So what's up?
So you
So
were saying something before I come in.
okay, so you come in and let me yes.
Okay, so I want to ask whether the child's attention has been worked on. Because I go back to the attention, because without the attention, other activities, you can never get the child.
She responds to every activity that you give her, but she can't talk. But anything that you want her to do, she just show you a sign that she wants this. But giving her a pencil or something to color or write, it's a problem for me. That's what I want to know.
Please, how do you go about it? Do you force the child or you do it gradually? Maybe you
I
hold
don't
the
force
child's
her.
hand.
I
Okay,
just give
and
her the thing. She just look at her friends, whether the friends are trying to do it. She'll just hold it, look at my face, laugh small, and tell you that she wants to go. She just show you the sign that she wants to use the washroom. Then she'll give you the pencil. Go to the washroom, remove the pant and throw it away, and come back and sit with you in the class without touching the pencil again.
so the child is escaping. So the why behind it, if I'm not mistaken, is the child is doing that to escape the task given to her or him. Because I think she's known that anytime there's something like that, when she says, I'm going to the washroom or I have to use the washroom, you allow the child go to do it. So the person has gotten his or her way out. Sometimes when this happens, you need to force the child to do it. Get the child do the activity before you allow the child go out. Because now the child is now used to, okay, anytime there's scribbling, anytime there's drawing, anytime there's writing, if I make a
Mina, are you there?
Okay.
Mina, are you there?
Yeah. Yes, I'm there.
No,
If
no, you
I
are
give
talking about
a
Mina. Yeah, she's there.
please.
Okay, Mina, are you there? All right. So, on that note, I'll take Richmond, and then when Mina comes back, she comes to hit on that. But then also, Madam Cynthia, do your
Yes.
possible best to join tomorrow's session, okay? So tomorrow is going
Okay.
to be all about teaching an autistic child at home and in school,
Okay.
okay?
Okay.
And then setting up an
Okay.
environment that is very conducive for an autistic child at home and in school. I will be the one
Okay.
to take that training for tomorrow, so you do well to join in as well. Right. So let me pick
Thank
Richmond.
you.
Sure. Richmond.
Yes, sir.
Yes, sir. Good
Good
evening. You can
evening.
ask your question.
Thank you very much for this opportunity. Yes. Uh, with my boy, usually uh, he plays with adults rather than his mates. I took him to school, and the teacher was telling me that he likes to play with the teachers. He gets closer to the teachers to play with them rather than his mates. They will be holding him, they will be touching. He will not mind them, but he prefers to play with adults like his teachers and people that are older than him. And also the therapy. Yes, I took him, and then for an assessment, they did an assessment. They said I should do a speech. I should get a speech and then occupational therapy for him. But uh, the cost involved going to having, I wish I could do it most of the time because I see doing it will be more effective. But I think 2 days ago, I spoke with a speech therapist and he mentioned price. I told him, Master, you know the money I earn. When we calculate it, meaning I'm not getting anything. So you should do something. You see? So I was thinking if, I don't know, but if they can do something about the therapy price so that those that want to come more will have maybe reduced price or something. I think it will help.
All
Okay,
right.
thank you.
Sure, sure,
All
sure.
right.
Thank you very much. Okay, so touching on the older part, Mina, are you here? Okay, she's not here, so let me just handle that. So, looking at why is it that the child is clinged to a particular age group and not the kids? Probably you understand that maybe he going to the colleagues or the age mates, they are not comfortable around him, or they don't welcome him the most. You have some of them pinching him or pushing him away or even slapping him or hitting him harder, of which he has at a point in time would not want to come close to them. However, if the teacher is that person who is more, okay, Mina, you are here. All right, sure, sure, sure. Okay, so let me repeat that for Mina. So because today is about her, yeah, so for me. So let me just let her enjoy the moment, and I'll come in tomorrow. So Mina, I'm coming. Let me just unmute you so that you can come in again with your. So as omitting you, his question was that his boy is all the time clings to adults. Yes. Mina, you are not good, all right. Okay. So I was also looking for your name. All right. So his question was that his boy is all the time clinged to adults, okay, and will not come closer to her age mates or her colleagues. And also with speech therapy, most of the time it's very expensive for him. He will wish can do it at home, but then it's very expensive. So what can he do at that moment? Yeah.
Mm. What were you saying? You were contributing. Don't say today is all about me. So please tell me what you were saying before. Because sorry, I was
All right, sure, sure. So, as I was saying, probably maybe when it gets to the kids they are not welcoming him. Some of them will have to pinch him, bite him, or hit him hard. So he finds solace attached to the teacher or attached to any adult who understand the condition and help him the most. And some also have sensory issues with what we call the olfactory sensory issues. When they like a particular smell about you, they will come to you and they start sniffing you. So they get attached to you and they get connected to you. So that is why maybe you would find him clinging to adults. And then this will tell you that most of the time, your child likes sweet scented perfumes or probably sweet scented smells. So children don't normally put on perfumes. So you see him move to the adults because he wants to smell them, he wants to sniff them, he likes what he's smelling and wants to come close to it, want to enjoy it the most. Yeah. And then in line of speech therapy, as you spoke about being very difficult, most of the time I would urge that when parents go for speech therapies, okay, you should also be there to be part of the process because a speech therapy will only book you for a session. I'm yet to see a speech therapist who would have you for the whole week. Yes, I'm yet to see that. But most of the time, they hit you up, let's say they give you sessions because there are other people they need to attend to as well. So it is best that when you go for speech therapy, you form part of the process, okay? So that when you come home, you can now come and extend the activity that you did with the therapist at the house. All right. And also try your possible best to improvise. That's why I'm saying that do well to join tomorrow's lesson. And tomorrow is going to be about how you can work in the house and also work at home. Mina, you can take over.
Yeah, that's all. You've said it all. You've
Okay.
said it all.
Mm,
Yeah, you've said it all. That is why we say we don't work alone. Speech therapists don't also work alone. They work in collaboration with the parents as well. So you get sometimes you are paying them, you need to ask them for certain tips that you can also do to help at home and all that. So yeah, you
All
said it
right.
all.
Sure. Today has been very wonderful and very educative. And thank you very much, Madam Mina, for your time. And in fact,
Yeah,
we are blessed to have you.
sorry, before you close the session, I want to end by saying that you are not alone in this. Parents, you are not alone in this. Caregivers, you are not alone in this. Teachers, facilitators, you are not alone in this. We've signed up for this and we need to put in the work. I know sometimes it's very difficult, very demanding and all that, but let's continue doing what we are doing. And sometimes when you are getting frustrated, just cast your mind back to the impact you've made in the person's life, what you've been able to help the person achieve. Let it motivate you. And sometimes I know I've been in some schools that they do beat autistic children. Please, if we are part, let's put a stop to it because they are in their different world. They don't know what they are doing. Everything they are displaying out there is a form of communication to us. So let's try to always know the why behind it. And as I said, I'll give them Google form to David to put it on the platform, the community. Please join. David will put my number out there as well. Please, all those I said, kindly contact me for us to talk. Please contact me. Let us talk and know how we can best help these children to be able to also fit into the society and be one of us. With the right therapy, with the right help, they can also live a fulfilling life, just like we are doing now. Thank you so much. And David, thanks for having me.
Thank you very much as well. And God richly bless you for your time. All right. So participants, today has been very fruitful and today we've been able to work a lot. And now tomorrow, you're going to have understanding autism with regards to how best you can teach your child at home, okay, with just the things you have at home. And then also utilize what you have in the school as well. So tomorrow is going to be all about teachers. I myself, I'm a teacher. So we're going to talk about everything teacher and everything school and everything home. How about teaching with regards to books? Because now we've heard from the speech therapist, we've heard from the behavioral therapist, we've heard from a child development expert and a pediatrician. Now let's come to the school. Let's come to the home as well. So meet you same time tomorrow. We are going to meet here, and then also Saturday because Doc, I told you that on Tuesday and then Thursday, from the feedback, Doc has agreed to sit and answer most of your questions. She's gotten a lot of feedback from you, and she's saying that she would want to meet all of you and then answer most of your questions before you can hit her in consultation. All right. So this is what she's giving you for free. This is for free. So do your possible best to leverage on that. So Saturday, we're supposed to end this meeting on Friday, but on Saturday, we are having a consultation with Doc. And so prepare all your questions with regards to anything that you want to ask Doc, and Doc will be here on Saturday to answer all your questions for you. Yeah, so please do your possible best to join in on Saturday as well. On that note, we want to say thank you very much, Madam Mina. Thank you for having us, and also thank you all of you as well. So see you same time tomorrow. It is bye-bye for now. Bye.
Mm.